No tool is as essential, fundamental, and enlightening as the physical examination. It is the cornerstone of the doctor-patient relationship, a dance of discovery that reveals the secrets hidden within the human body. Begin by introducing yourself, a simple act of courtesy that sets the tone for the entire examination. Remember, the person before you is not merely a patient, but a human being with their own fears and concerns. Ask for their permission before you proceed. A verbal consent, clear and unequivocal, is a must. It respects the patient's autonomy and safeguards their dignity. Once you have obtained consent, it's time to collect some basic demographic data. This includes the patient's age and sex, information that can help guide your examination and contribute to your diagnostic reasoning. Now, turn your attention to the patient's general appearance. It is here that the first clues often lie. The patient's body build and effect can tell you a lot about their overall health. A thin, frail body might suggest chronic illness, while an anxious or depressed effect could hint at underlying mental health issues. Next, embark on a careful inspection of the skin, hair, and body. The skin, our body's largest organ, can offer up a treasure trove of information. Look for any abnormal spots, rashes, or lesions. Observe the color and texture of the skin. Is it dry, oily, or perhaps unusually pale or flushed? The hair, too, can yield valuable clues. Excessive hair loss, changes in texture, or patches of baldness could point to a range of conditions, from nutritional deficiencies to autoimmune diseases. The body's contours and symmetry should also be assessed. Note any unusual lumps, bumps, or swellings. These could be signs of tumors, cysts, or other abnormalities. Your hands are your next tools. Perform a palpation of the skin and abdomen. Feel for any areas of tenderness or pain. The skin's temperature, moisture, and elasticity can provide further insights into the patient's health. Now it's time to listen. Auscultate the patient's heart and lungs. The rhythmic lub-dub of the heart and the soft whoosh of the lungs can tell you if these vital organs are functioning as they should. Any irregular sounds or rhythms warrant further investigation. Lastly, perform percussion of the patient's abdomen and chest. This age-old technique can help assess the size and density of the underlying organs and detect any fluid or air that shouldn't be there. In conclusion, the physical examination is a crucial part of medicine. It is a process of discovery, a journey that takes you beneath the surface to uncover the stories that bodies tell. It is a testament to the power of touch, sight, and sound in diagnosing and treating disease. So embrace this art, master it, because in your hands lies the power to heal, to soothe, and to make a difference in the lives of your patients.